Cancer is a disease of the body's cells, which are the basic building blocks of the human body. The body constantly makes new cells to help us grow, replace old cells, and heal injuries. Normally, cells grow, multiply, and die in a controlled way. However, sometimes cells become abnormal and keep growing. These abnormal cells may turn into cancer. Sometimes these abnormal cells will form a mass or lump called a tumour in solid cancers such as breast or prostate cancer. Abnormal cells can also build up in the blood such as leukemia or lymphoma. Cancer, also known as malignant tumours, has the potential to spread and invade into the nearby tissue. The cancer can also break away into the bloodstream or lymph vessels to other parts of the body. These are called metastases. Cancer can be treated with surgery, radiation therapy, or drug therapy. The types of drug therapy used include chemotherapy, hormone therapy, targeted therapy, or immunotherapy. All of these therapies can be used on their own or in a variety of combinations. Because cancer treatment is tailored to each individual, the treatment you have may be different to the treatment other people have, even if they have the same cancer. The treatment recommended to you by your team will depend on the type of cancer you have, where the cancer began, whether the cancer has spread to other parts of your body, specific features of the cancer cell, your general health, age, and treatment preferences, and what clinical trials may be suitable. Chemotherapy refers to drugs that kill or slow the growth of cells. These drugs are called cytotoxic, meaning they are toxic to cells. Cancer cells are cells that divide rapidly and grow out of control. Chemotherapy works by travelling through the body to target rapidly dividing cells in organs and tissues. There are many different types of chemotherapy drugs, and each type destroys or shrinks cancer in a different way. Chemotherapy works by entering your bloodstream either by a tablet or capsule taken by mouth, injection into the skin, a drip into your vein, or a needle into your spine. Chemotherapy can also be delivered directly to the cancer, for example, into the bladder. Your treating team will talk with you about the plan for your treatment, including which drugs will be used and how they will be given. Chemotherapy can be used for different reasons: to achieve remission or cure, a decrease or disappearance of the signs and any symptoms of cancer, to help other treatments such as surgery or radiation therapy, to control the cancer even if remission or cure is not possible, to relieve symptoms. These may be important things to discuss with your treating team. Chemotherapy can also damage healthy rapidly dividing cells throughout the body, such as new blood cells in the bone marrow, cells in the mouth and stomach, hair, skin, and reproductive organs. Throughout treatment, you may experience some side effects. Not everyone experiences all of the possible side effects, but they may include fever and increased risk of infection, nausea, the sick feeling in your stomach, or vomiting, bringing up your food, loose stools or poo numerous times per day, known as diarrhea, or stools that are hard to pass, known as constipation, not feeling hungry or losing your appetite, temporary loss of hair, feeling more tired than usual, known as fatigue, sores in your mouth, known as ulcers, tingling or numbness in your hands and or feet, known as peripheral neuropathy, and difficulty remembering things, known as brain fog or chemobrain. Side effects may worsen as your treatment continues, but should gradually improve once treatment stops and the healthy cells recover. Many side effects can be managed, so speak to your treating team about your experiences as they can provide suggestions. New blood cells are constantly being made in the bone marrow. These rapidly dividing cells can be damaged by chemotherapy, which means the number of blood cells will be reduced. There are three main types of blood cells. Red blood cells carry oxygen around your body. You may feel tired or short of breath if these levels are low. Platelets help form clots to control bleeding and bruising. If your platelet levels are low, you may bleed for longer than normal if you cut yourself or have a nosebleed. White blood cells help your body fight infection. These include a type of white blood cell called neutrophils. If these levels are low, it means it is harder for your body to fight infections. This is why it is important to monitor your temperature. A high temperature or fever is a sign of infection, and with a lower immune system, you need help from the hospital to fight the infection. You may at some point require a red blood cell or platelet transfusion, but your treating team will talk to you about this if needed. It is also important to contact them if you experience any shortness of breath, persistent bleeding, or a temperature above 38 degrees Celsius. You will have blood tests at the beginning of treatment and before each chemotherapy cycle to check that your blood count is okay to have more chemotherapy. If blood levels have not recovered, your treating team may delay treatment until it is safe to have it. During and after treatment, there are extra things you can do to take care of yourself. Take any medication as prescribed, as it can help prevent the onset of symptoms such as nausea or diarrhea. It can also help prevent having a reaction to the chemotherapy. Ensure good hygiene with regular showers using a mild soap, and use a gentle moisturizer to prevent dryness or cracks on the skin. Maintain good oral hygiene and mouth care. Brush your teeth with a soft toothbrush to avoid bleeding gums. Use a gentle mouthwash such as water mixed with salt or sodium bicarb, or a mouthwash with no alcohol in it. If you use regular dental floss, then continue, otherwise avoid it. If you have a central line, known as a PIC or Hickman line, examine the skin daily to check for redness, swelling, or tenderness around the site. Keep the dressing dry at all times, and if it becomes wet or peeling away, call your treating centre for advice. Also check that the caps or bungs remain on each line. If you have a totally implantable venous access device, known as a port, wear a button-up shirt so it can be easily accessed by the team. Or if the line is in your arm, please wear clothing that can easily be removed to allow access to that area. When attending your appointments, feel free to bring a support person with you, and consider bringing a book or something to keep you entertained. There are extra things you can do to stay healthy and safe when out and about. Try to keep active with 30 to 60 minutes of light exercise per day, such as walking. You may feel more tired than usual. Make sure you have time to rest when needed. Some treatments can make your skin sensitive to the sun, so be sun smart when outdoors and wear a hat and sunscreen. It is safe to do all the things you usually would, but ensure good hand hygiene. You may want to carry hand sanitizer with you, and consider wearing a mask if in crowds. Whilst having chemotherapy, it is important to try and reduce your risk of getting an infection. You can do this by staying away from others while they are unwell, washing your hands or use sanitizer before preparing food, eating, and after using the toilet. Wear thick gloves when gardening to avoid any cuts, which will also prevent infection from soil that contains a lot of bacteria. You can also speak to your treating team about what vaccines you should have, such as the flu vaccine, which can provide you with extra protection. Although you may experience a decreased appetite and changes to your taste and smell, it is important to eat foods that will help you regain your strength. Some helpful hints whilst on treatment may be to eat small meals or regular snacks rather than large meals. Eat plain or bland foods if feeling sick in the stomach. Try to keep hydrated as best you can, especially around treatment days. If you are having trouble eating, ask to speak to a dietitian who may have some helpful ideas. During treatment, while your immune system can be compromised, additional food safety measures should be taken to reduce your risk of infection. A good general rule is to eat well-washed, well-cooked foods. However, you should be careful with the following foods: raw or undercooked meat, poultry, seafood or eggs, cured or highly processed meat from a deli, unpasteurized dairy products, soft cheeses or anything with mold in it, food past its best before date. It is also essential to avoid contamination by safely preparing foods. Be sure to wash your hands, surfaces, and equipment thoroughly, especially after preparing raw meat. Thaw frozen foods in the fridge overnight rather than at room temperature, and cook until steaming hot. Don't defrost and refreeze food more than once. Eat food that has been freshly cooked and served immediately. Use leftovers within 1 to 2 days. Chemotherapy treatments can affect your fertility and may affect your personal relationships, including your intimate relationships such as sexual activity. If you are of childbearing age and wish to have a family or add to your family in the future, please discuss this with your treating team. It is okay to continue your usual personal and intimate relationships, including sexual activity, while on treatment. However, there may be some side effects that may make this a bit more challenging. For example, a decrease in libido, feeling like you don't want to have sex, erectile dysfunction, trouble getting or keeping an erection, or vaginal dryness. There are strategies you can use to help with these side effects. Please let someone from your treating team know if you wish or need to discuss this further in private. It is important that you do not get pregnant or make someone pregnant while you are having chemotherapy. Speak to your treating team about the most appropriate contraceptive for you to use. After your treatment, the chemotherapy can stay in your body for up to a week. During this time, very small amounts of chemotherapy may be released into your bodily fluids, including vomit, urine, feces, blood, saliva, sweat, as well as semen or vaginal discharge. You may worry about the safety of your family and friends during this time, but there is little risk to others as they are not likely to come into contact with your bodily fluids. It is important to follow these safety measures at home to help reduce exposure for both you and your family. Put the lid down when flushing the toilet and use a full flush. Wash any items soiled in bodily fluids separately and use the longest cycle on your machine. If you or someone in your household needs to clean up any bodily fluids, put on disposable gloves, soak up the spill with paper towel and soapy water. Put all the waste, including paper towel, cloths and gloves, in a bag and put it in the general rubbish. Wash your hands with soap and water after touching anything contaminated with bodily fluids. Use a disposable, thick plastic bag or plastic bucket if you need to vomit after your treatment. The plastic bucket may be washed with soapy water and is safe to use again. Do not crush, chew, or cut chemotherapy tablets. If you are having trouble swallowing them, speak to your treating team. Use a condom for sexual intimacy for a week after your chemotherapy. There are some symptoms that you should seek help urgently for by either attending your closest emergency service or contacting your local treatment centre for advice. These include temperature 38 degrees or above, chills, sweats, shivers or shakes, breathing difficulties, uncontrolled vomiting or diarrhea, pain that you can't get under control with your usual medication, any other symptoms that are new or concern you. The following symptoms should also be reported to your treating team as early as possible: headache or stiff neck, sore throat, cough or cold, mouth ulcers, rash or redness of the skin, swelling, redness or pain around the cannula, catheter or wound site, pain or blood when passing urine. The main thing to remember is that we are here to help and support you through this time, so please contact us with any questions or concerns you or your family have.